On our list of orthopedic tests for lower extremity, continuing with the knee, Apleys with compression and Apleys with distraction. What are we looking for? What tissues are we evaluating with that?
Meniscus. Isn't it meniscus?
Yeah, absolutely. So this test, the patient is prone. So you're going to have the patient, can you lie prone, please? So I'm going to have you flip over on your stomach.
Prone.
So we're going to bring the leg up to about 90 degrees. And with the compression portion, you're going to push down and you're going to internally rotate and then externally rotate the knee with pressure. Think of the structure. So when you're pushing down, remember the meniscus is a little, thin band of soft tissue. That helps the knee glide, because remember the knee's the largest joint, it's a hinge joint, so it helps that knee glide. It also causes a little bit of a cushion, so the bones aren't smacking down into each other. But that meniscus can sometimes get torn or frayed. So when you're bringing it up to 90 degrees, when you're putting that pressure down, it might trap that piece that's torn or frayed. So when you rotate to either one of the sides, it's going to cause pain. It can sometimes cause some clicking or locking of the knee too. Usually it's going to be pain though. And so with the compression portion of that test, you're trying to evaluate the meniscus. If you then using your knee to secure the posterior thigh down, you're going to push that down, and now you're going to lift that leg up, that lower leg up, and again, you're going to internally and externally rotate the tibia and the fibula. With that test, you're evaluating the MCL and the LCL. There should be no pain, no feeling of that instability in there. If so, there's a chance that those are the tissues affected. I remember when we go back to that terrible triad of O'Donoghue, that test you might have two positives there because there might be an MCL issue and a medial meniscus issue as well. Then if you have the patient, can I have you on your back, please? So then McMurray's test is a test, this one is just for the meniscus. So in that eyes of the spine, again, you're going to either internally rotate or externally rotate. Let's say we're going to internally rotate first. We're going to bring it up towards the chest and then back down again. And you're observing for pain, for any clicking under your fingers, which I did feel in there. But that's a positive finding. So you're going to internally rotate, then externally rotate. Bring it in and bring it back down again. Normally that shouldn't hurt. Some patients like that. Do you have any meniscus issues or nothing? Some patients they're going to have some clicking or some crepitus in there. It might be a precursor to a meniscal injury. Remember, if the patient has a meniscal injury, they're going to report they can't fully extend their knee, or walking is going to be difficult because that meniscus can get stuck in that hinge, and sometimes won't allow full flexion and extension. You're not going to be able to fully extend that leg. Sometimes by doing that test, we talked about that's also a way that orthopedic they can release, they can release that meniscus as well. Let's say we suspect a pretty moderate meniscal tear. What test would you order? MRI. And with the meniscus, usually with your more mild to moderate meniscal tears, they respond really well to conservative treatment. Easting is really good to try to just flush the swelling out of the area for pain control. Again, if it's causing the patient a lot of pain or it's interfering with their range of motion, they're just impatient, you send them to an orthopedist and they'll go in there sometimes and they'll do the arthroscopic surgery, they'll go in, re-wrap it, pretty much trim off any of the rough edges. Sometimes with that though, like we discussed with any surgery, sometimes they create a lot of scar tissue. So if the patient's on board for more conservative needs, all the better for them. So why don't you guys try those then?